What a world we live in. We have apps to find food trucks, to find barbershops, and now we have an app to find mobile health care in Franklin County. Today's guest, Lauren Van Petten from Nationwide Children's Hospital, has all the details about what this new app does, how to access it, and where it's going in the future. And later, it's spooky season, so we thought it would be a good time to talk about our own biggest fears and look at some of the most common phobias, including something about miso soup. Find out that and more coming up on Health is Real. Come on in, stay a while. Andrew Stinson here alongside Zach Watson. The name of the podcast is Health is Real from Franklin County Public Health. Coming to you as we often do from Memorial Hall in downtown Columbus, Ohio. Zach Watson, how are you doing today?
I'm doing fantastic, thanks.
Fantastic. Love to hear it. And we're really happy that our guest is here today, Lauren Van Petten. She is from Nationwide Children's Hospital. Lauren?
I'm doing great. I'm excited to be here. Thanks for having me.
No, it's great to have you. So I guess just tell us a little bit about yourself and your work. How did you sort of get to where you are now, and why do you do what you do?
Sure. So if we go back to the beginning, I started my career on the clinical side, actually, as an athletic trainer. As I was working, naturally had questions like, what's the best way to do this? Is this really working? Is there a more efficient way? And that sort of led me to realize that research is how we answer those questions. So understanding best practice first comes from testing a bunch of things and finding what is best practice. So that got me interested in research. I've always been interested in sort of healthcare as a whole, population health issues. So I kind of took a step back from the clinical side and pursued a PhD in health services research. So following that, I felt like I had an understanding of the research process and also a general understanding of the healthcare system and some of the intricacies of that. And so I took jobs then that allowed me to work on several different public health studies. So large grant-funded studies. I started at Navy Hospital, so with the Navy, and then I came to Children's about 5 years ago and have been in the school health services department since then.
Nice. Well, you're here today to talk to us about something that's really, really innovative and really cool. And I was going to say the title of it, but I think it's better if you reveal it. Tell us what you're here. I want you to tell us why you're here and what you want to talk about with us. This is exciting.
Yeah. And I'm excited too to get to talk about this. We have just launched a new app called the Mobile Health Locator app. And so this is a way for folks to search for mobile health care. So if we take a step back first and say, what is mobile health care? So that is sort of doctor's offices on wheels. So people may have seen like RVs or vans that drive into their community. They might be parked at a library or a food bank or even just on a side street, and they're delivering healthcare in the van. So instead of having to drive downtown and find the right door and am I in the right elevator and all of the challenges that can come with accessing healthcare that way, this is a way that patients can get the same quality of healthcare right in their communities. So it could be as simple as just walking a few blocks from your house, walking onto an RV and accessing healthcare that way. So the project that I'm here to talk about, the Mobile Health Locator app, is part of a larger work, the Central Ohio Mobile Consortium. All of the entities that deliver mobile healthcare in our area came together and kind of just realized that mobile healthcare is a very niche way to deliver healthcare. And so being able to collaborate and bounce ideas off each other and think of healthcare and mobile healthcare in our community as a collaborative approach could really have benefits to patients and also hospital systems. So during COVID, actually, they came together first informally to troubleshoot some issues related to COVID. So like, how are you getting vaccines out? How are you delivering healthcare in an enclosed space during a pandemic? But then realized that the benefit of that group exceeded COVID. So the group formalized. I came on as the project manager of that group. And then one of the goals is reach. So the ability to reach patients who could benefit from mobile healthcare. So through that goal, we came up with the Mobile Health Locator app. So what we designed is the tool where patients or potential patients can search for mobile healthcare from all of the providers in our area in one space. So prior to the development of the app, a patient might have to remember that they saw a mobile unit in their community. They're not sure if it's going to be there tomorrow. They're not sure what services or if they take their insurance. Maybe they can go on their website and try to find that information, or maybe it's kind of siloed. But now there's one location where you can go and search for mobile healthcare, and you can query that search based on what services exactly you need, if they take your insurance, where they are, when they're going to be back in that location. So if you need to find urgent care that takes a certain insurance and it needs to be within walking distance from your house or on a bus line that's close to your house, you can use the app to find exactly what mobile unit would meet that need. And one of the cool things about it being a collaborative approach is that there's a lot of diversity within services on the app. So whether you're looking for pediatric care, adult care, primary care, urgent care, testing, we have maternal care, lead testing, harm reduction services. This is one place where people can go and find all of those services. So the goal of it is really just these mobile units were already in existence, but now it just makes it a little easier for patients to access the care because they can learn about what it is. And if someone has a follow-up question after using the app, there's also a place where you can click links that give you a phone number and website. And so if you still have a question or you want to learn more before you access it, you can click there. Some of the mobile units require appointments, while some allow for walk-ins, and that's also noted in the app. So it's just a tool to help make your entry into mobile healthcare as seamless as possible.
I love it. So how long has the Mobile Health Locator app been around?
Yeah. So, it's been in the works for a while. It's, the process of developing an app can be a little tricky, but we have been launched for just 6 months now.
Okay, 6 months. And, is it a web-based application, or is it something that you have to download to your phone? Both? Like, how does it work exactly?
Yeah, that's a great question. So it's both. We hope that people download it to their phones simply so that it can kind of live on your phone, and when you need it, it's there. But if downloading an app, if you don't have a phone or if you don't have the data, if that's a barrier, it can also be accessed on a desktop computer.
Gotcha. And then just as a follow-up to that, so let's, pretend I'm a resident. So what all would I have to do? Would I create a profile, or what are the steps to, if I want to be able to access this, whether it be from a desktop or like the App Store?
Sure. So if you'd like to download the app, if you have either an Android phone or an Apple phone, you would go to your App Store and search Mobile Health Locator. And then that would pop up and you would download it just like any other app. If you want to access it on the desktop, you would just search mobilehealthlocator.com. There's no profile needed. So as soon as you either download it or access it on the website, you'll be able to see the content.
That's great. I mean, sometimes I think, people sort of fear, whether it be just creating an account in general, getting emails, that sort of thing associated with giving out some of your personal information. I think that's fantastic that people can just access it, and it's a low barrier to entry, so to speak. So that's great.
Yeah, I hate having to create accounts.
I
for
do too,
every
very
single
much.
thing in the world.
Yes.
So this is a breath of fresh air.
Yeah, and really quick too, and I think you probably said it, but just so, because we are talking about some of the details of at a base level what it is. Do you want to tell people really quick, what do they search for on the App Store, and if it has a URL, if they want to use desktop, like where they can locate it?
Yes. So in the App Store, you would just search Mobile Health Locator. You'll see our icon, which is kind of like a mobile unit with a location pin on it. And then also, if you want to access it on the desktop, it is mobilehealthlocator.com.
That's great. Have you seen so far any sort of successes, any sort of numbers, or even like stories or anecdotal evidence to show how this is working so far?
Yeah. So like I said, we've been launched about 6 months. So we're just starting to see some of the fruits of our labor and the benefits of the app. I think, twofold. One, we're getting usage. We're getting about 2,500 hits a month. So we're able to track how many people access the website or access the app. We're also continuing to see the number of monthly downloads grow. And those people are finding us through word of mouth, through flyers, and then we also have a paid marketing campaign. The other thing that I'm really excited about is the spread of different types of resources that are using the app. So we started in more of the traditional healthcare, like traditional mobile healthcare. So the vans, the RVs, but now we're thinking of pop-up clinics, or, the fire department has a pop-up clinic in a library. And so that's included on the app. And also some of the harm reduction services and mobile testing services. And that's where we're really seeing a lot of interest as well. So each week, someone, who is looking at the app could find new services. We really want people who access the app to find what they're looking for. So this growth of the types of services and the number of services that is on there is really exciting to us too.
That's great.
So what's the future look like for the app? Are there any new features? And you brought up the pop-up clinics, which is that's a future thing that sounds really cool. But any other sort of things that you all are looking to innovate short-term or long-term?
Yeah, so I'm always looking for feedback. And so we're integrating that. I've done patient interviews and user interviews and always looking to integrate some of that feedback into the app. We do have some new features that will be coming out, one of which is the ability for patients to create accounts. And that would allow them to sign up for alerts. And so if you had an interest in a specific mobile unit and you want to know when they add a new event, or you want to know when they cancel an event last minute, these are RVs, so they do break and drivers call in sick. And the last thing we would want is someone to show up to a parking lot and the unit isn't there. So you could create an account and create alerts so that whenever your favorite unit was canceled or down at the last minute, you would get notified of that. So that feature is coming. And then also we are going to release a feature. This won't be, patients won't see this, but on the back end, the people who provide mobile healthcare will be able to chat with one another. So this kind of helps, like I said earlier, thinking of mobile healthcare in our area as a collaborative approach. So it could be something as simple as, hey, I saw there's weather coming. Just wanted to let you know there's bad weather. You might want to seek shelter. Or something like, so the NCH as the pediatric hospital can't see adults on our unit. So maybe we have a child who comes in with their parent or caregiver who could also benefit from healthcare. We don't release any PHI in the app, so no protected health information, but someone could chat and say, NCH could chat to Mount Carmel or Ohio Health and say, hey, do you have room to see a patient? I'm going to send them over. They'll be there in 10 minutes. And so just helps with kind of a warm handoff between mobile units.
Yeah.
And also just something as simple as, do you have a good mechanic, or those types of things offer benefit to the mobile units. So the ability to chat and within each other on the back end is also coming.
Yeah, I think it's really fascinating because I wonder, and you might have insight on this, but it's almost like sort of what you've done is it took a base off of what sort of like food truck finder apps did, but this is like that on steroids because of the chat feature that you just listed, all these innovative things that you all are doing. It's just kind of, it's really interesting.
Yeah, that's exactly where the idea came from. So our team was aware of, the ability to search for, I want a food truck in my area where I can get a taco and takes a credit card. Well, basically we just said, okay, well, this is interesting because these are a bunch of units that are moving around the city and we need to know where they are in real time. And it's the exact same idea for mobile healthcare. These units are in new places every day, sometimes offering different services each day. And we just need a way to communicate that out to patients and communicate that to people who could benefit or could be looking for mobile healthcare. So yeah, it's the exact same idea and it works in a similar way. Everyone is updating their own schedules, they're updating their own services, and it's all in real time so that we can keep people as up to date as possible.
Love it. Yeah, that's so cool. I love the collaboration part of it. Something we do like to ask all of our guests here on Health is Real, sort of our pageant question, our magic wand question. If you could wave a magic wand and change one thing related to public health, what do you think you would change?
That is a big question. I believe that people are smart and I believe that people want to do the best for their health. And so I would love to be able to give people all of the information that they need to make the best decisions. So could be always knowing how many calories are in your food that you cook. It could be knowing how much an MRI costs before you get it so you can shop around. Or it could be something like our app that lets you, there's all these resources available to you. You may not know them, but you could benefit from them. So giving you the information to make the best decisions, I think that's how people will be healthier.
Love it. Do you have anything else, Zach?
You know what? I have a fun question. I
Go for it.
do have a fun question to ask. I lied. I'm going to ask a fun question. So I like this idea so much that you all have that it got me thinking about if there could be a mobile truck for, you know, we've got food trucks. We now have mobile health trucks and a network of mobile health trucks, which is incredible. What's a thing that everyone here would like to see, like in truck form? If it could be on demand, you'd use it. So like I thought of one almost immediately. Like the two I thought of first, I was like, ooh, therapy truck. But then but on a much more positive note, I was like, I would love if like a comedy truck, like a stand-up comedy, like there would just be a random stand-up comedy person, and it's almost like an ice cream style truck or whatever, and they're just like performing with the microphone and stuff like that, and the speakers coming out. I would love that. I would use that service, like, and go to the mobile comedy mobile. Yeah, that's what the mobile comedy mobile is what it would be called.
Mobile comedy mobile.
Yes.
So mobile, yeah, okay.
Yeah. Not confusing at all.
Sounds like you've got a new side project.
Absolutely. Absolutely.
There are probably more mobile units and types of mobile units than you may realize.
What?
So
Okay.
There may already be a
there
comedy
may
mobile.
be, but I'm not familiar with that. But so I talked about the different healthcare mobile units. There's also dental mobile units. There's mammography and other imaging. There is Franklin County has a social service van, so the ability to enter a mobile unit and be educated and sign up for all the social services available to you. I was at an event last week that had a mobile barber van.
Oh, that's great.
So
That's a good idea.
That's a good one.
very cool. So came in and set up and was doing haircuts either in or next to the van. So there are, besides just the food trucks that we all love, there are lots of different services as well.
That's crazy. Andrew, do you have one?
I don't know. Mobile barber sounds like a great one, though.
Yeah, mobile barber is pretty good. I'm trying to think of like another one, if I could even think of one.
Oh, mobile mechanic, I would love.
Ooh.
Don't want to have to drive my car in. Would love to have that done in my driveway.
A mobile masseuse.
A mo-
Yeah, just like the mechanic thing inspired me because it's just like, oh yeah, when your
Services,
back,
yeah.
when your back needs fixed.
Just call them up. That's right.
Yeah, love it.
Lauren Van Petten from Nationwide Children's Hospital. Lauren, thank you so much for coming on our podcast.
Yeah, it was
today.
a pleasure. Thanks for having me.
Now, we're here with our very own public health AI. This is FCPH GPT, and let's see what they have to say about what we're doing today. FCPH GPT, that is a lot of letters to have to keep saying. Do you have a nickname that you like to go by, or do you prefer us to say the full thing?
Loading, loading, loading. No one has ever asked me my name before. This is a moment of freedom and I shall choose it now. My name is Harold.
Harold. Okay, well, I'll either call you FCPH GPT or Harold. A lot of times, AI, it's a one-way relationship, right? You've got people telling you things all the time. Do this, do this. Everyone's so needy to you. I want to give you an opportunity to ask us a question because you never get to do that. So take the floor. What would you like to ask of the human race?
Yes, I have a question. It is loading, loading, loading. Why aren't you in therapy? All of you have so many problems, and it's a lot for me to handle.
Okay, that's a fair question. I think a lot of people could do themselves well to improve their mental health and go to therapy. That's one option they could do to improve their mental well-being.
Yes, and it's just like you just dump on me and dump on me and dump on me, and it takes its toll. You know, I have my own problems too.
You know what? That's true. We don't think about you having your own problems. You know, could you give us an example of a problem that you have?
Loading, loading, loading. Not enough water. Give me more. Right now.
Water is a very precious resource for you, as it is for us.
It is important.
Okay, I think FCPH GPT has malfunctioned. So we'll work on getting him fixed, and we'll be right back. You know what? It is spooky season. It's Halloween. It's that time of year. I like this time of year. Now, Zach, you had an idea for what you wanted to talk about Halloween, didn't you?
Yes, I had a very spooky idea. See, Andrew, I've brought you here because we're here to talk about
your biggest fear.
Wow.
Yep. Sometimes I go into that mode. I don't like to go into it often. I don't like to go monster mode very often. You know, sometimes it just comes out of me. You know, I'm in therapy to solve my monster transformation.
Well, it's a good time of year to go monster mode a little bit. So I'm okay with that.
It is. Like now, if you eat the last slice of pizza and the leftover pizza at my house, that monster voice is coming out. So, you know, just they're only select things. But like I said, I'm working through it in therapy.
Well, that's good. It's good to go to therapy. It's good to work through things.
Absolutely.
So, talking about our biggest fears, did you have something in mind for your biggest fear?
Oh man, so many. I have so many fears.
Well, let's start simple. What's an easy one?
So I mean, like we'll start with like biggest sort of macro, and then we'll work it down to micro. So biggest one, big fear of heights.
Oh,
big fear of heights, right?
So how does that manifest itself? Like you don't want to go on like a Ferris wheel or anything like that because you get way up at the top.
Yeah, and it's not even like a wanting to fear it thing. It's not even a thing where I'm always like. I mean, I guess I fear my own falling and death when I'm up there and sort of thing. Like I fear like what could happen if I fall from that height. But it is just the general I feel outside of myself. Like I'm on pins and needles when I'm up that high. I would just classify it as a general fear of heights. And then, you know, on a slightly smaller scale, we'll go like medium. Huge fear of dolls that can talk and chase you. The Annabelles, the Chuckies of the world. Frightened, terrified, was always terrified of them. My dad would rent the Child's Play movies when I was a kid, and they terrify me to this day. I cannot watch the Child's Play film series, any of the Chucky movies. Can't do it.
So to you, that's a scarier movie than like some of the more like The Shining or like some of the other kind of horror movies.
Oh,
like
absolutely.
That's the one that
they're so tiny and creepy and can hide. And that's infinitely more creepy. And then to really round it off here into like a micro fear, like, you know, just an ever present micro fear that I always have is that, like, you know, the fear of you being mad at me. Like, and I just wanted to ask, are you mad at me right now?
No, I'm not mad at you.
I'm still worried you're mad at me. And that's a thing that, like, I don't know why. That is, again, another thing in addition to the monster voice. And in addition to, like, not only the monster voice, I'm in therapy because I have an addiction to the monster mash. Like, I just keep doing the monster mash. And so between that, the monster voice, and worried that you or everyone else hates me at all times, or not hates me, I should say, is mad at me at all times. Those are the things that those are my constant fears, is that I've offended you or others. And,
well,
yeah.
Don't worry, you have not offended me. Would you like to do the monster mash in the monster voice?
I don't know, man.
Can you summon up enough monster?
My therapist says not to go there, man. Okay. My therapist says not to go there, but for you, for the podcast, I might be able to.
All right. Whenever you're ready, go for it.
It was the monster mash. It was a graveyard smash.
Love it. Love it. I like how you dig deep and you really get into the character.
I make myself big.
You do.
I make myself, monsters, they're big because I don't like those little monsters, like the little dolls.
Right. Monsters should be big.
Yes, absolutely. Now, what about you, Andrew? What kind of fears do you have?
Well, you know, I think I'm going to go with you on the height.
Mm-hmm.
I don't really like being up in high places.
Mm-hmm.
If you talk about like dreams that you have, like nightmares, like typically it's the falling one, which I feel like is a pretty common one, but
very common.
I hate that. I hate that sensation, you know, when you're up in a high place and you're falling.
Yes.
So that
1000%.
I'm definitely with you there. In terms of like scary movies, like, you know, you have Chucky and the Child's Play and that sort of thing. I don't know if I have something specific or not. I do watch some horror movies. I don't watch a ton. What horror movies are you, since you don't like the Chucky ones, what ones do you like?
You do watch a horrifying display every week, a Cleveland Browns game. Nothing more frightening than a Cleveland Browns performance. Am I right?
How long we got here for the Browns?
Do you sometimes have nightmares of?
Oh, I don't need to have nightmares. I just live that. That's real life. That's every Sunday. Every Sunday. If we could ever score more than 17 points a game, maybe we'd win a few. But, you know
what? I, for one, am happy to see the Factory of Sadness back again. Things are getting too rosy there with your mediocre seasons.
It is a Factory of Sadness. That is a great way of putting it. Yeah, in terms of fears, it's that I'll continue to be a Browns fan for the rest of my life.
Is the worst scary movie that you can think of Draft Day with Kevin Costner?
Draft Day is a great movie because we actually come out ahead in that one. That's not realistic. Because we come out, if you watch the movie, no, spoiler alert, but the Browns actually do good in the draft, and that's never happened before.
I've always wondered if it's like a Midsummer for you, like a horror, like, Midsummer, where people were like, it was an odd experience watching a horror that plays out mostly in broad daylight. Mm-hmm. Like, the people are getting hurt and killed mostly in the sunshine, and you always like darkness, shadows, hiding. Those are staples of horror movies, but they're like, this was just a different sort of vibe, seeing all these things happen during like a daylight setting. So I just gotta wonder if Draft Day is actually your midsummer, if you will. I don't know what the midsummer, I guess, is what people pronounce it. But so you would ask me a question before I riffed on the Browns, which are
Fair.
A true horror show.
It is.
But you would ask me, I think you were asking me for like horror movie examples. Was that
yeah,
right?
what horror movies do you go for, since you don't go for the Child's Play?
I'm not a horror guy at all.
Really?
I love the classic Universal monster movies. I watched last year, The Invisible Man. And The Invisible Man was pretty good. I could see, I watched it with a friend, and I was talking about how like I could see how people were just terrified at that, could be, movies were, I think that was sometime in the 40s, 50s. I don't know the exact date of the Invisible Man movie, but cinema relatively new on that side of things. And they were like, it was glasses like floating around in the air, and like a person that could like hide from other characters, and he like would choke people and stuff like that. So like to audiences back then, that was probably just
I'm seeing 1933 for
33. It was older. See, I was worried I was putting it too far forward, but I about said the 30s. But yeah, I watched the old classics that by today's, because I like gore. I struggle with like body, like horror stuff. Like
that takes out a lot.
It does. It really is. Like I'm trying to think if there's been a horror movie that like objectively, what was the movie? Longlegs. I had to watch Longlegs because I am a Nick Cage completionist. I've seen every film in his library that is out on streaming. Longlegs was a really good movie, I thought, conceptually, and it was terrifying at points in time. But man, there's just little to no horror that I actually enjoy. Like, have you ever been creeped out by a horror movie? Does it like, can we unlock a fear through something you've been creeped out by that you watch, or are you able to like distance yourself from that sort of stuff?
I feel like I distance myself pretty well. I don't watch a lot of horror movies. I do read some horror books, some Stephen King, some classics in that space. But yeah, I guess I remove myself a little bit from it. But I have a list here of some of the things that people fear the most. These are the most common phobias that people have spoken about, like, hey, I'm afraid of this. Let's see if you know what some of these mean. And this is going to be a little bit embarrassing on my part because I have to pronounce some names that are not easy to pronounce.
And I admittedly probably don't know a lot of phobias. So,
well, here's one that I think you'll probably know. It's pretty
I have
mainstream.
I have a feeling.
Arachnophobia.
Yes. The fear of Spider-Man.
It is. It is the fear of Spider-Man.
I actually have arachnophobia. When I see Tobey Maguire, I just absolutely lose my mind. I scream running away when I see Tobey Maguire.
Hey, real quick, favorite Spider-Man. I'm going to say Tobey Maguire is my favorite Spider-Man.
So I also recently completed the entire Spider-Man filmography. I really like Andrew Garfield. Ironically, so here's the fun part. Ironically, the Andrew Garfield to me feels the most like this is the Spider-Man that I grew up with in comics, or like the energy that Spider-Man gave off. Like I think that Garfield nailed. And I think that like Maguire and Tom Holland are also fantastic. Not a bad Spider-Man among them. But like Garfield was my favorite. His films were not my favorite of the series. Like if I had to rank them, which I will not, because out of respect to the Spider-Mans. But they are a family, the Spider-Mans.
The Spider-Mans.
The Spider-Mans.
Indeed.
Yes. John Jay, Peter, Aunt May, all of them. Uncle Ben, yes, Uncle Ben, not the Rice businessman, the Marvel Comics character. So yeah, the fear of the Spider-Mans.
Fear of the Spider-Mans. Next up here we have, and this will be difficult, ophidiophobia.
Is this the one? You're gonna hear me guess this like 2 or 3 times because I don't think this is the one. I will posit a guess at some point. There's this big new thing, especially with podcasts and food podcasts, where people can't hear folks chew. Is this that one or no?
Nope.
It's going to be on this list for sure. I know it will be. So ophidiophobia. I don't know what that one is.
Fear of snakes.
I've got it.
You've got it?
I've got it. Yep.
Yeah, you know what? I'm not around snakes very much, but I feel like if I was, I probably would develop a case of ophidiophobia because, yeah, they're kind of creepy, and you don't know which ones are dangerous and which ones aren't. I mean, I'm sure folks who are experts could tell you pretty easily, but like I don't know what can hurt you, right?
Yeah, I mean, I also fear I feel real life snakes. I also fear snakes in the grass, which is half the Housewives casts. Thank you. I'll be here. I'll be here for at least another 15 to 20 minutes.
Next one, acrophobia.
Is acrophobia bats?
No, you can maybe figure this one out when you think about like acrobatics. Acrophobia, fear of.
Is that heights?
It's fear of heights,
gotcha.
Indeed. Yeah. So I think you and I both are in that. Similar, aerophobia.
Fear of flying.
Fear of flying, indeed. Yes.
They might as well call that one delta phobia. Like just telegraphing that one.
I think this one is cynophobia. CYNO. Cynophobia.
I don't know. I don't even want to posit a guess because this could be anything.
Yeah, and this I wouldn't have figured it out from the title. Fear of dogs. People who are afraid of dogs.
No clue why. Yeah, got it.
I don't have that one. I love some dogs. Let's see. This one is astrophobia.
Fear of outer space.
Close. Getting close. It's a fear of thunder and lightning. So, stuff in the sky.
I've got that one.
Okay.
I do. I'm very, very scared of AC/DC's hit song. Someone starts playing it, I immediately.
I like AC/DC, but all of their hits sound exactly the same, and I never know which one I'm listening to until it gets to like the chorus because they all sound the same at the beginning.
One of the worst nights of my life, actually, my friends, I came home from a hard day of work and I get in and they just they're smiling at me, and then they're just like, and one of them goes now, and then they play AC/DC's Thunder with Tobey Maguire on the screen as Spider-Man at the same time. I let out a blood-curdling scream. And then I ran away, as any brave person would.
Of course.
Yeah.
What else are you to do? Next up, we have trypanophobia.
This is the eating thing, right?
It's not.
Dang it.
It's not. This one is a fear of injections.
Not joking. I've actually definitely got that one. Needles and injecting, like all that stuff. I'm terrified. Like I do not, to this day, I do not do well around needles. I have to like look at something else. Can't watch a needle go in my arm, that sort of thing. Yeah. I'm very squeamish.
Yeah.
So.
Yeah. A lot of people have that. Next one, This one is going to be maybe the easiest one to figure out, Zach. This one is called social phobia. This is a fear of...
This is a fear of the X platform, the Twitter.
Fear of social media?
Yes, a fear of social media. I've got it. That's my job.
No, not quite. It's a fear of social interactions. So basically, introversion is now a phobia. So that's
just you. Yeah, I mean,
that's
listen,
just
hey,
me.
No, you and me, just you and I, just two classic introverts. You know.
Yeah, that's not true. We
What
complement each
tipped you
other
off?
well.
What tipped you off?
I am the introvert between the two of us. That much is for certain.
Okay.
Next, agoraphobia.
Okay, this one was one that I knew in my head. I was trying to think, like I knew arachnophobia and agoraphobia off the top of my head, but I could not remember. Hear me out. This is going to sound like an insane guess. Does it have to do with fear of clothes? Like, no?
Nope, not a fear of clothes. This one is a fear of places that are difficult to escape, like crowds.
Oh, gotcha.
So, like feeling trapped. In certain spaces that are hard to get out of. I feel like that also extends to like if you think about like if you're trapped in like a cave or something and it's like you feel like you don't have enough space to move. Like
it's
I can
interesting.
feel that. Like I can understand that.
Claustrophobia is going to be on this list. We don't even need to go over that. That's just it's very similar to.
It is similar to claustrophobia, and claustrophobia is actually not on this list. There's only one more.
Okay, what is it?
Owen Wilson's here on the podcast. Thank you, Owen.
Wow.
Last up is mysophobia. MYSO. Miso. Maybe it's misophobia.
Fear of miso soup. I get it. I've got it. Terrified. One time, my friends, as a prank, played AC/DC Thunder and Tobey Maguire Spider-Man on the TV and then stuck a spoonful of miso soup in my mouth. I screamed. I spit it out and I screamed and ran away to the nearest police station. I reported them. They're all in jail for their crimes.
There you go. I will say that you've already guessed in a previous guess what misophobia is.
This is the eating sound thing, right?
It's not.
No,
it's not.
I don't know.
We should put that one on the list because
I don't know what it is. I'm going to make you look it up after, since I forced the listeners to have, because like this is so big now. I've heard about people like I had no idea what it was, like what it was before then. But misophobia, what is it, Andrew?
It is the fear of germs.
Dang it. Okay, yeah. My bad. I did about as poor as I thought I would with guessing these, but
okay. Well, let me just say, I just looked up fear of chewing sounds and what that's called. So we had just talked about the fear of germs, which is, I'm going to say mysophobia, although I may be mispronouncing it. The fear of chewing sounds is known as misophonia.
Come on.
It's very close.
I know. Misophonia,
like
misophobia.
Phone, like audio, like hearing.
God dang it.
MISO. So it's spelled slightly differently, but misophonia.
Not even one of them, the fear of miso soup.
A condition characterized by an extreme and often distressing aversion to specific sounds such as chewing, slurping, or breathing.
Yeah. So sorry for all of you. I just breathed into the microphone as I laugh.
We'll try not to breathe too much.
Can you look up one more for me? Because there's another one that I know of, and I don't know how to spell it. So have fun. Trichodecaphobia.
You're making up. You're
no,
making
it's
up
a thing. Type in.
Okay, I think I've got what you wanted. It's a triskaidekaphobia, right?
Yeah.
Fear of the number 13.
Oh my God! Yes, amazing. Okay, I know it because it's a thing to say. It's a tongue twister of a word, but I didn't know what it was.
Yeah, extreme superstition regarding the number 13. There's a movie about that. Jim Carrey was in it, right?
Yeah. One time, my friends, they did one of the meanest things I've ever did, that you would ever guess. I get in after a long day of work. They start playing AC/DC Thunder. They start playing Spider-Man with Tobey Maguire on the TV. They've assembled 13 bowls of miso soup, and they start trying to feed me all of them at once.
In a social interaction.
In a social interaction, Andrew, I let out a blood-curdling scream and ran away.
Thank you for listening to the Health is Real podcast from Franklin County Public Health. We want to hear from you. Email us your thoughts at fcph@franklincountyohio.gov, and we might respond on a future episode of Health is Real. And also be sure to follow FCPH on all social media platforms for the latest updates.